Hello, everyone. My name is Zachary Brooks from UGenome. We make genomic medicine personal and accessible for everyone. I'm really excited today to be able to have a conversation with Dr. Jaden Lee, who's the Chief Genomics Officer for UGenome. All right, so this is just for the average person. They take a medication. How do they recognize something is going wrong? How do they recognize that maybe they're having an adverse drug reaction?
So usually the temporal relationship is the one thing that you definitely want to watch out for. So as soon as you start a new drug, or if your drug dose has increased, you want to watch out and monitor for any new symptoms that you never experienced before that could potentially help you recognize some of these adverse reactions. But there are certain medications where the adverse reactions are not really time bound. So it could really happen anytime, even if you've been taking medication for years. So in that case, you need to be prudent to be aware of this type of side effect is possible, and continue monitoring this sort of signs and symptoms of this type of reaction. So it's really about keeping a close eye on your body. Of course, you know your body the best, and communicate with provider, because sometimes it might not be adverse drug reaction. You might be developing another medical condition.
Hmm.
So having an open communication with your doctor will help you recognize adverse drug reactions.
I mean, what your response kind of tells me, which I know, but also, and I've heard over and over again, is really how central and important it is that we know ourselves and we trust ourselves and we really take full participation in our own healthcare, or healthcare now represented through taking medication. So, do you have any examples of a patient who's been really dialed in on their body and getting better at taking medications and maybe being able to get off of medication over time?
Yeah, so there are few cases. Of course, one example is patients with diabetes, especially in the early stage. Because of their blood sugar level was so high, they will be put on a diabetes medication, but they make significant changes in their lifestyles, and then they may come off of the medication. Now, I personally don't call that like a reversal or anything. You still have diabetes. It's just that you're managing diabetes with lifestyle changes. So that's another one example. And the other cases, of course, with lots of mental health disorders. Some of the patients, we have a common misunderstanding that mental health condition is like a lifelong. While some patients can recover, and they can really recover well, that they might not need medications. So that could be also a case as well.